Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we have the pleasure of having Dr. Jay Wrigley back on our show. Many months back, if you remember, we had some technical difficulties, and he only got through about a half of his presentation. So we're going to be talking about his hormone optimization diet. As we talked about many times before, Jen and I specialize in hormones as pharmacists, but it's also just a piece of the puzzle. If we don't have the right diet to optimize the results of our hormone balancing, then we're not going to get the best results. So Dr. Wrigley, welcome to our show.
Good to see you, Janet, and I'm ready to get into whatever you want to get.
Yeah, there we are. So tell us a little bit about your background in functional medicine and what you do, and then we'll get into the meat and potatoes of the hormone optimization diet.
Yeah, so my history is as a functional medicine doctor. I practiced clinically for about 27 years, and then at that point, I decided that I was kind of burnt out on the clinical side of this, and wanted to look for a way to open up, my level of influence because of. We'll get into my specialty here in a second, but it just made sense to see if I could build this out and do this remotely to work with people all over the world rather than just Charlotte, North Carolina, which is where I was born, raised, and spent most of my time practicing healthcare. And that worked out really well, took off well, and now I'm able to do my work all over the world. And I'm kind of an expat now. I live in the Dominican Republic at the time being, on the beach, and it's great. And all this came out of the fact that over probably the last 10 to 12 years of my practice, I began to develop a a unique specialty in the combination of hormonal chemistry, especially around females, only because it's not like it's all that different between females and males. It's just that if you look at the demographics of who actually goes to doctors and seeks out, information to do something about their health, it's far weighted in females, right? So,
Yep.
that had been a specialty of mine for more than 20 years. But then when I began to pair that with this emerging science of metabolic health, because of my own letting my own health get out of whack and gained a ton of weight while I was practicing medicine and teaching others how to eat a healthy bullshit diet. And excuse my language, but
Yeah.
the typical standard of recommendations of lower your fat and eat a bunch of whole grains and all this kind of stuff, which I thought that I was doing fairly well and ballooned up and whatever. But I took my understanding of my own of hormonal chemistry and applied it to what happens when you eat food. There's a hormonal response to that, and that has everything to do with how your body's going to partition these nutrients, whether it's going to store them as fat, whether it's going to burn them as energy, whether they're going to be utilized in a healthy way or not. And I began to build out something that really worked for me, and I was able to lose almost 100 pounds. And then I married the two together. And so what I've done for probably the last 10 or 12 years is to work mainly with this demographic of both men and women, but large percentage of women who are going through certain hormonal changes. It could be just perimenopause, moving towards menopause, or into menopause, or because of these things developing thyroid issues or adrenal burnout issues, or lots of different things that have to do with both hormonal balance and metabolic health. And that's where I've been, and that's what's been extremely exciting, is because I see that the way to get the best results for most of us that are past the age of 40 to mid 40s is the game changes. The hormonal landscape changes in our body, and it sets us up for something that is not really talked about that much on social media. You guys see it all the time. Everybody believes that just eat a low carb, high fat diet. Do the keto thing, and which can be extremely effective. And it's probably the greatest diet ever to lose a bunch of weight if you're a 30-year-old man. But when you've got declining levels of certain hormones in your body, which I'm sure we will discuss, the idea of cramming a bunch of fat into your diet uh, when you don't have the hormonal metabolism in order to deal with that, what we would call energy toxicity, you're going to run into a problem. So you have to do one or two things. You have to dial back and reformulate the macros of the diet, or you got to get hormonally balanced. And I'm sure we're going to get into that too. But so that that's kind of in a nutshell where I landed, and
All
what I
right.
do on a daily basis is kind of coach people through these types of things.
So, Janet, as a woman, what questions do you have for Dr. Wrigley?
Okay, so for myself, I think there's a big difference between perimenopause and menopause. What is your opinion on that with hormonal changes in diet and maintaining weight?
Okay. Um, well, the biggest difference that I see in the difference between peri and postmenopause is that in perimenopause you are the main complication, and with not only weight but so many other things, is the separation of the ratio between estrogen and progesterone. So what usually happens is a woman in her can start as early as late 30s, but usually we will see this in the in 43, 44 up to 46 or whatever, where there becomes a significant drop in her ovarian output of progesterone, but her estrogen levels are still staying relatively the same as they've been for a while. And that ratio expanding further and further between these two hormones, when they kind of antagonize and
Mhm.
support each other or whatnot. But what they don't want to be is to have a big gap between the ratio
Right.
between the two, because if you do that, you're going to get yourself in a situation where in perimenopause, most women that I'm seeing are experiencing this, what we call estrogen dominance, where you've got more estrogen than you have progesterone to
Mhm.
antagonize that estrogen. And that excess estrogen or progesterone deficiency, I mean, there's so many different ways this can play itself out. But that ratio gap is what it is that's leading to these issues where
Mhm.
when a woman starts to see that her periods start getting closer and closer together, she's having heavier menstrual cycles. She's having much more of a problem with mood swings. She's not sleeping well. She's gaining, weight rapidly and all this kind of stuff without changing her diet or whatnot. This is a lot of that ratio change in favor of there's a lot of estrogen around, but not enough progesterone. Then when you add to that certainly in the last 3 or 4 years, if we take, tack on COVID and all the other things that women are going through, and you've got a bunch of stress in your life,
Yeah.
then your body's robbing that little bit of progesterone that you have in order to shunt it towards the cortisol pathway.
Mhm.
And so you're getting elevated of cortisol, and that's going to shut down fat loss completely. That's going to be, put the brakes on this kind of thing. So now you're using up the little bit of progesterone that you do have. Now you're in even a bigger gap of this estrogen dominance. But we can go further with that, or we can reformulate the question.
Well, let's talk about specifically your hormone optimization diet. You kind of mentioned that keto is not the best for a perimenopause menopausal woman. So, what would you suggest?
Well, my take on this and is that the ultimate way of eating for midlife and beyond, including peri and postmenopause, and even for men who reach middle age, is that you want to uh, prioritize protein in the diet.
Yeah.
Proteins, protein seems to be pretty much the key for a number of factors. One is the satiation of the diet,
Mhm.
because many people can't eat too much protein. They're going to eat protein until the fact that I don't feel like eating any more protein at all. And so to prioritize protein as the number one macronutrient in your diet, then you build the rest of the diet around that, right? So, so my thing with the hormone optimization diet really is the thing that I put out a lot with a hashtag that is lchpmf. So that's the low carb, high protein, moderate fat version
Okay.
of a low carbohydrate diet. And why I see that to be so beneficial for this demographic that we're talking about is that when you begin to, again, when you begin to lose the metabolic effect that comes along with estrogen, testosterone, progesterone, and a few other things, then the idea of putting a bunch of fat in your diet when you're already you're being set up for being a better storer than a releaser
Right.
for
Mhm.
sure. So to take in more energy than you need and then expect your body to be able to figure out what to do with this doesn't make any sense at all.
I agree.
So this is
Yep.
where the low carb, high fat protocol, which is great if you've got neurological issues or you're a younger person, can work out really well. But later on, you don't need a bunch of fat added to your diet. But at the same time, I need to make it clear because some people get mistaken by this, and I have to answer this all the time. Is I get tagged a lot of times of, oh, you're going back to the eat a low fat diet. Not in any way. Not in any way am I talking about a low fat diet. I'm just talking about uh, eating primarily the fat that comes with the protein that you choose. So if you eat a ribeye, we all know that a ribeye's
Right.
got a nice amount of fat on it, and it's got that's what gives it great flavor. That's enough fat, right? You don't
Right.
need to cook the ribeye in a stick of butter for some kind of purpose of you're driving ketones or something like that. Not if not for a 48 to 60-year-old woman. That's not doing you any good at all because you'll never burn through that fat
Right.
that you took in dietarily before your next meal. So that the hormone optimization diet really is to just look at how we dial back a little bit on the huge amount of fat that would be in the typical ketogenic diet, and we prioritize protein a little bit more because if you remember, and I know both of you do, that the original therapeutic ketogenic diet was low carb, moderate to low protein, and high fat, where we're finding that that was not enough protein to really drive
Right.
what it is you want for your metabolism, for muscle structure, for brain health, and all this kind of stuff. So the premises of the hormone optimization diet is really to really stick it back into balance. And the thing about it is that this isn't some kind of new concept I made up. This is what it would have been like to before the agricultural revolution. If you ate the same diet that people are talking about on Twitter and social media right now of being a carb, well, this is kind of what that would have looked like because the hunting of wild game back 20,000 years ago, these were not fatted animals. I mean, these were not domesticated, you know, pastured. Yeah, you were chasing down something that probably had extremely low body fat. You were looking
Right.
for
Right.
elk or deer or something that did not come with marbled meat and all this kind of stuff, right? So it's really just a diet that, again, is another way to say some of the stuff that's been written before in the Neolithic diet or the Paleo diet or whatnot. Of you know, we're eating. We have a tendency to cram a bunch of fat that doesn't need to be in the diet at a certain age that just doesn't need to be there. And if you really want to get leaner as a menopausal woman, anyway, and perimenopause, what I see that is, the bullseye is to increase the protein, modify the fat a little bit, and then still keep your carbs pretty low.
Well, and from what I get, what you're saying is basically just eat real food, and
Real food.
and yeah,
Right.
and you will get enough fat. You will, if you prioritize the protein, so basically eat meat, you're going to get enough fat, and and you'll get satiated that way. And the keto diet, I agree with you, 100% about, if you have certain diseases and you need to be truly keto and add fat, that's great. But just to add, a stick of butter to your coffee because it's
Mm.
good for you, I'm not buying that.
Not
Um,
buying it at all.
no,
Not
and
buying it at all. Not unless you've got like grand mal seizures or something like
Right.
that. It doesn't work.
exactly
Yeah.
right, and there again, it is extra fat, and fat is concentrated in calories, so it is calories that are going to store probably as fat if you're not burning them.
Well, one
Sure.
thing too that seems to happen in this process, and I guess being a female, I notice this with our clients, is that you start also losing your lean muscle mass if you're not doing that, and that is crucial. If you're losing that lean muscle mass, then that's not a very healthy thing, and the only way you're going to maintain that is if you're putting that protein back in. So that seems to be a conversation I have with women, and I totally agree with you that, that priority of putting protein first and a good protein first, whatever that might be in their diet, is crucial. Um,
Sure.
to caveat with that though, um, what is your feeling about testosterone in women post and peri?
Well, I've got two. I mean, I think I know where you're going with that. First of all, I think testosterone and supporting testosterone is a great idea for every woman. Now, where I veer off the pathway here is I'm not a big fan at all of testosterone therapy for most women. Now, I'm not saying that there isn't a point in case for that. It comes up for sure, but to just add that to the mix, like so many um, GYNs will do, or other practitioners that are doing some kind of functional medicine, and go, look, we're going to put you on bioidentical hormone replacement therapy. Let's just definitely add testosterone to it. I think there's a bit of a maybe maybe we don't know enough yet that it should not be just the standard practice of medicine. Like we love to do it, put things in a box of, like, you've got this type of staph infection, so you need amoxicillin or whatnot. That every woman who goes on bio HRT or whatnot needs testosterone included in that. However, I mean, it's a touchy subject. You can tell I'm fumbling through that because I'm like, it's such an important thing because of that women live so much longer than they used to, than we all do, but women certainly outpace men with their longevity. And so having perfect hormonal balance, which might include that they need some extra testosterone from a good source that comes from an exogenous source, is makes a whole lot of sense. On the other hand, we have plenty of research and papers that say that's got to be delicately thought through, because you put a woman on, she gets herself on too much testosterone or too early or whatnot, you get some problems maybe with bone demineralization. You get the possibility if she creates too much androgen hormone, and then she all of a sudden at 50 years old, she's got acne and polycystic ovaries or something like that. So I don't know that I have that one answered. This is one that'd be fun to kick back to you guys, since you work in the compounding of formulation. Is Let me say that back. And what are you finding about adding testosterone to bio HRT for women?
Well, I will say that, excuse me, I think testosterone is probably one of the most important hormones for women. Progesterone probably first, especially early
Yeah.
on in perimenopause. But when you think about some of the diseases that women have, you mentioned demineralization of bone. Now, I've never heard of testosterone demineralizing bone. In fact, testosterone, I have an ongoing challenge for anybody, doctor, scientist, healthcare professional, anybody, to find a better drug for osteoporosis than testosterone. There's not a better drug to build bones than testosterone, for women and for men. And think about men. Men get osteoporosis also. It's not from lack of estrogen. It's not from lack of progesterone. It's from lack of testosterone. So also to help maintain lean body mass, helps for depression, helps to burn fat, helps to decrease insulin resistance, helps to burn visceral fat, helps libido. So I think testosterone is a big game changer. To your point, though, it does have to be dosed right,
Yeah,
correctly. You
I
don't want women
agree.
to get
Sure.
oily skin and acne,
I
but the
think
benefits are
Yeah,
incredible.
I'm going to jump in here because I think where I get uncomfortable with is the injection. I don't like
Right.
injections for women. And I don't like the pellets either, because I
Yeah.
feel like they get overdosed. And that's when we start getting into some issues. I think if you're using something that a low dose that's conservative for women that need it, absolutely. Because one of the issues that I see, and this is kind of from, dealing with a lot of women, is that a lot of times if they can maintain lean muscle mass, and they don't have to have huge doses. We're talking, 1 or 2 milligrams or even less, depending on where they are with it. Um, it does help maintain that. And also, like Shawn said, that delicate part of rebuilding bone and muscle, I think is super important, or maintaining it is super important. So,
Yeah.
I don't, I stay away from that. I don't like the pellet thing. And me personally, I mean, I know there's some people that do, but I just think it's too much at one time. And then they have this excess, and then this less, and it's excess, and then it goes down. And so I don't like that yo-yo of any of that, because I don't think that's
Absolutely.
healthy as well.
It's not a
Well,
consistent.
yeah. And one of the problems
Yeah.
with
I
pellets
mean,
too
yeah.
is,
Go ahead.
well, one of the problems with pellets too is they don't address any of the local symptoms, which could be vaginal symptoms.
Well, that's true too.
Whereas
Yeah.
if you apply testosterone vaginally, there's not a better drug for vaginal atrophy and vaginal dryness than testosterone. And pellets don't address that. So many women will still
Right.
need something for their vaginal dryness if they're on pellets. So I'm a big believer in, using vaginal testosterone, because not only it works systemically, but also locally.
Yeah, so we're on the same page. I think that the only difference is just comes in the fact that I look at it because I'm I don't know this, and I don't want to take this for granted, but I I like driving pathways when I'm working with a client or a pet, and making things do what they're supposed to do. So
Yep.
my thought about what we're talking about is I'm on point, Shawn, exactly with what both of you are talking about, and your explanation of testosterone. However, I also know this. I know that progesterone is the precursor and the builder for most of all of this
Mhm.
that we're
True.
looking for. And the thing where most practitioners miss is that they don't understand that you can't just put a woman on progesterone and just hope that, okay, that takes care of the deficiency ways and your body converts that exactly where it needs to go. Now, there's a way to make sure or push that progesterone into the testosterone pathway. And there's a way to, antagonize that excess estrogen so that we can get thyroid hormone to convert properly and get into the mitochondria. And that takes a little bit of, the understanding of the biochemistry of how you use things like nutritional supplementation to
Mhm.
drive progesterone in its right way. We might need to calm the adrenals down and stop
Right.
producing cortisol so the progesterone can move closer towards the testosterone pathway.
Very true.
But I mean, we're all, yeah. I mean, I can see exactly what you're saying, and but what's exciting about this is that this is the new frontier of healthcare. This is, and it's. I hope that everybody in the world, pays attention to what something like this conversation, because they're out there stuck in this disease management
Yeah.
system,
Mhm.
which
Right.
is just, we have a cookbook approach to, if you've got this set of symptoms that we can give a name to and make a
Yeah.
diagnosis, then
Yeah.
there is a standard of practice protocol. And if you step outside of that standard practice of protocol, then, oh no, red flag, you could be pulled out
Mhm.
from under your umbrella by the hospital administration that oversees your clinical practice. I mean, it is,
Yeah.
you know what I'm talking
Yep.
about, right?
We
Yeah.
just talked
So
about it this
Absolutely.
weekend. Yep. Yep.
yeah, so this is what's exciting about this, is to get people to realize, my big thing is to try to teach people about, you got to become self-reliant in
Mhm.
your healthcare. And because if you're gonna, you're, you're gonna listen to big pharma and big food and big everything else,
Mhm.
and hope that they're there when you've got a real problem and they're gonna fix that for you, that's not really gonna happen, right?
No.
But yeah, go ahead.
Well, our goal is, just like you were saying, to your point, is to educate and empower individuals to take charge of their own health.
Oh, sure.
Right. And as doctors, as pharmacists, as healthcare professionals, that is our job, is to educate them. They have to ultimately do it themselves. If if patients are looking for a doctor or a pharmacist to completely change their life, it's just not going to work. I mean, you can
Yeah,
listen to them, but 24 hours a day, you've got to take care of your own body ultimately.
absolutely. Yeah, you got to do the foundational stuff, right? And then you utilize, or people like you two, and those of us who've got a little bit of a specialty in how we can you know, make this even better for you by understanding and teaching you. But we fight that uphill battle too, which is still garbage. That we still have to deal with the fact that I get I got I think three messages today, and this happens every day for all of my life. Of, well, and these are from clients half the time. I had one of them today I'll speak about. So worked with a client from Australia probably 3 weeks ago. She got started on her protocol. I took her off of the what I believe to be garbage hormone replacement therapy that she was on and put her on what I believe to be really pure bioidentical estrogen progesterone. And we did a little
Mhm.
bit of testosterone push through just some supplementation. I get a message back about I feel better than I've ever felt in 3 weeks, but I am really concerned about am I setting myself up for cancer?
Yep.
And I'm going, man, I don't mind explaining that to you because I have to do that every day like you do. But it's a shame that there's not enough information out there that is providing this for people, that this is actually much more cancer preventative than it is a risk factor for cancer. Now, there are those certain cases where you're not going to throw something like estradiol at a woman, uh, but by and large, done correctly, and this, you're actually you're doing more to probably prevent this person from getting either cancer or a reoccurrence of cancer than you are doing anything that is going to lead to harm, right?
Well,
But the
absolutely. And
the,
it's
the
it
education's not. Yeah,
it's ignorance. I mean, it's pure ignorance in the medical establishment, and partly because a lot of the studies that have been out there, and of course, this, Dr. Wrigley, they're with Premarin, and or medroxyprogesterone acetate, and those are so different than
right.
estradiol and progesterone. And I think the
So,
biggest culprit is medroxyprogesterone acetate. That drug is horrible. um,
yep,
and really the important thing is progesterone. And
right.
we're taught in medical school or in pharmacy school that, oh well, if you don't have a uterus, you don't need progesterone. I mean, that's the ignorance out there. I mean, think about that. That is the
Absolutely.
dumbest thing I've
Dumbest
ever
thing.
heard. I mean,
Yeah.
so you're telling me that progesterone's a magic hormone and it only works in the uterus? Seriously? I mean, what hormone works only in one tissue in the body? None.
Oh, and it's so, I mean, we could just talk about that forever because here's the thing, most of the reasons for the hysterectomy in the first place were because of a predominance of something like estrogen dominance, right? So here's what
Yes.
we'll do is we'll take your uterus out, then we'll put you back on estrogen without any progesterone to antagonize that estrogen, which just furthers the whole complication in the first place. But the woman goes, well, I don't really know that because I don't have a uterus. So the symptoms went away. Meanwhile, you're pushing the whole thing that set you up for the hysterectomy in the wrong direction.
Yep.
It's just unbelievable. We see this every day, right?
Well, I mean, think about what we do in medicine, in traditional medicine. If they're less than 40 and they're having, uterine fibroids, irregular periods, anything that, around their cycles, well, you need birth control pills, right?
Yeah,
And if you're more than 40 and you're having those symptoms, you need a hysterectomy. I mean, that's exactly what we do. When in reality, like you say, it's like progesterone, progesterone, progesterone. That's
yeah,
all I needed.
and enough people don't even understand that when their doctor says that they put them on progesterone or a birth control pill that is progesterone based or whatnot, they're not talking about progesterone. They're talking about a progestin, and the
Exactly.
lay public doesn't know that these are
Yep.
not the same animal at all.
Well, actually, Dr. Wrigley, many gynecologists don't know it. Many pharmacists
Absolutely.
don't know it. I mean, they put them in the same category. Even in my
Really?
pharmacology book, they put progestin and progesterone in the same category. And here's how different they are: progesterone, progestation. It's
Gestation, right?
it's to help support a pregnancy, and progestins are birth control pills. That's how different they are.
Right.
Yahada, let's go ahead and stream our comment. Looks like we have a comment up there. We got a few of them, it looks like. Let's see. Laura Turner, thank you for listening and watching. She's a loyal listener. What is frustrating is the agreement among providers on how a woman should be treated. I've talked to 3 different practitioners, and they all say something different, things about progesterone, testosterone. So frustrating. I agree with you 100%, Laura. You have to find somebody that works for you, and there are a lot of different mindsets out there. And I will tell you, as a compounding pharmacist that treats mostly hormones, we have providers over on the left-hand side and providers over on the right-hand side. And sometimes you have to come somewhere in the middle. Ultimately, every patient is different, and we want you to feel better. So I've been trying for over a year to find a treatment that works and keep getting different recommendations from different doctors. Absolutely. Dr. Wrigley, what is your comment on that?
Well, I feel for Laura. This comes up every single day of my life, and I think that so many challenges there. One is that you've got this again, the standard practice of care where that you need to fit into what's the usual prescription for a woman for her health problems or whatnot. And if your doctor is not like thinking, willing to think outside the box of what it is that you need to be doing, then there's an issue there. Another thing is that doctors do not provide any type of getting to know them and you. And this is one of the things that I love about doing remote work now is that I can have somebody from anywhere in the world jump on and do a free discovery call with me. And that sole purpose of that is, let's see if me and you fit. I want to hear your case and what you're dealing with. And then I want to tell you my approach to that, and then give you a real clear answer of whether or not I think that I would be your best fit, or whether or not really. That falls outside of kind of my wheelhouse and my whatever. And I think that we ought to be looking for somebody else to do this. But you don't get that when you just make an appointment with a doctor. You don't get a whole lot of like, what do they actually do, what are they thinking, what do they know about hormones. And it is frustrating. It's very, very frustrating. And this is why so many people are doing their own due diligence on Google or whatnot, which that can be a problem too. But I feel for Laura. But my answer is that keep looking at what feels best for you. How do you want?
Right.
How do you want? If you feel like you have a hormonal issue, do you feel like your doctor is sitting with you and really understanding your hormones? What kind of testing are they doing? Because if they're just running a blood test on your progesterone level, I can tell you how useless that is. This is just progesterone traveling from one place to another, bound by a protein already, and it doesn't have any reflection of tissue levels or storage levels or free whatever. And if they're not looking at sex hormone binding globulin or whatever, whatever. And then,
Absolutely.
So anyway, for Laura, it's just that we feel your frustration. Keep checking out people and find doctors who will actually sit down and talk to you about your case before you make some kind of commitment to actually working with them is probably the best thing.
That's a really good point. And that not every doctor works with every patient. And that's why you have to find out who works for you.
And
and
because they do, we work for them.
Yeah, that's right. That's right.
I tell people all the time, fire your day. They're like, what should I do about my doc? Fire your doctor.
Yeah.
You employ him or her, right? It's not the other way around. It's like, but yeah.
So I wanted to get back into the diet and hormones and just give a quick analogy and what your thoughts are about this. We talk often about, I mean, many times, and you'll see this in your practice, I'm sure, Dr. Wrigley, is that people get frustrated with their weight and they want to blame it on their hormones, which hormones can be a big contributor for sure. But I always tell patients that hormones are a piece of the puzzle. You still have to get the other things right: sleep, exercise, diet. And here's a great analogy: is like they're just contractors. They're like contractors on building a house. But your diet is like the wood of the house or the steel, whatever kind of structure you're building. So if you don't have the good pieces of the structure, i.e. the good diet, the contractor, the hormones, can't do what's optimal to build an optimal structure. What are your comments on that?
Well, I think that's. I mean, first of all, there's nothing to say other than truth about that. I might go a little bit further with that and say what's interesting about hormones when it's related to diet is that a lot of people don't understand that everything that you put in your mouth has a hormonal response to it. And this is
Right.
one of the biggest problems that we deal with is that if people this is why calories in calories out doesn't work is because it's not about if you eat a tablespoon of sugar, what's happening in the body is it's not really about that sugar's not great for you or sugar's got a bunch of calories. It's about you just elicited a hormonal response that sets off an inflammatory cascade that it's going to take days for your body to get back on track from this, right? So hormones do play a role in why it is that you've got to eat that proper diet, Shawn, like that you're talking about. You got to lay
Yeah.
that foundation in the diet. But one of the reasons why you want to eat that diet is because it keeps your hormones, like you said, knowing what to do and functioning correctly rather than sending insulin through the roof. And then you've got, problems with cortisol elevating. And then you've got, all of this problem going on. So, yeah, so it's, it's the foundation that you've got to lay with your lifestyle. But you're doing that in part because of what that does for you hormonally, which is a beautiful thing because there's
Right.
nothing better than to have good hormonal balance. It's why it is that we see so many people who can get away with so much is they've got strong genetic hormonal balance. Now eventually that usually catches up
It'll
with them,
catch up on
but
them. Well, what I like about what you just said is you put insulin in there. And of course, we've kind of been hitting on that without saying it for the entire podcast. But, when we say hormones is such a general term. I mean,
yeah,
and broad
there's
term.
so many of them.
Right. And that's why, we have to really break it down. And, like for instance, when a doctor just ignorantly says, well, you've got a history of breast cancer, you can't be on hormones. I mean, that is the most ignorant statement I've ever heard of.
Oh
And so
yeah.
what I'll tell patients, I'm like, well, epinephrine or adrenaline's a hormone. Insulin's a hormone. Can you not, have any of those things? No. We have to break down what hormones are. And the most important hormone when it comes to overall function that affects all of our hormones, I used to say this, Dr. Wrigley, the hierarchy of hormones was adrenal, thyroid, sex hormones. But you know what trumps them all? Insulin. If your insulin is not in balance, nothing else will get better, or it won't be optimal. That's for sure. Correct?
Yeah, I mean, correct. I mean, that's a great conversation. I mean, we could have fun with that all day long because I would say, how could I argue that? But I also could say, wow, trying to pick one where, like, for instance, cholesterol is primarily a hormone. But if not, I mean, in the ways that it's not, then we could shift to the next step and say pregnenolone of being the
Right.
master hormone of like moving all. So yeah, it's an interesting conversation. But I think if I had to be held a gun to my head, I think I'd have to agree with you and say if you if your insulin's out of control, you you're creating everything that's going to walk you down towards diabetes, obesity, heart disease, uh, mental issues, Parkinson's,
Dementia, Parkinson's,
Alzheimer's. I
right?
mean, it's just
The list goes on.
yeah,
So Tanya Noble, another loyal viewer and listener, can you talk about optimal DHEA levels for women, and if supplementing, what is the best time of day to take it? I will go first, Dr. Wrigley, and then I'll
Yeah.
let you take over. So optimal DHEA levels for women, DHEA is, they call it an androgen. I don't like using that term because that makes us think that only men have it, but men do have more DHEA than women. So it is important to take a female dose of DHEA. Female dose of DHEA is anywhere from 5 to 25 milligram a day. DHEA is mostly made in the adrenal glands to help us respond to stress. As we age, DHEA levels go down. So optimal is, when you say optimal is different for everybody. So it depends on, what your goals are. So get your level checked, make sure it's on the high end of normal, if you're not having acne or oily skin anyway. So that's why it's different for everybody. And the best time to take DHEA is in the morning, because that's when our adrenals produce the most DHEA, is in the morning, to prepare us for the rest of the day in times of stress. So Dr. Wrigley, what do you got to say about DHEA?
I'm gonna pretty much say that you nailed that, Shawn. Here's what I would add to that. I find that DHEA is a mixed bag for sure in the giving it to women. So, so what I mean by that is this: the women who respond favorably to DHEA will respond to it at a low dose, and so I will often start women on 5 milligrams twice a day. And in some cases, if I just have a hunch that this is really needed, I might go to 10 twice a day for a total of 20. But here's what I find: there, it's a it's an interesting thing because of all of what we know about what the DHEA pathway is and where it leads to or whatnot. The research is not like super strong, like that it works for everybody. Like if we knew, I mean, we would know right now for sure if DHEA was the go-to libido stimulating nutritional supplement to take for a female, then who somebody would have already patented some kind of version of this, and they'd make $1 billion.
Right.
But it becomes one of those things where some women, this changes their life. Other women doesn't really do a whole lot of anything. And then in the third case, sometimes if you get them a little bit more than they need, then they're going to go that androgen pathway, and they're going to go, why all of a
Yeah.
sudden am I breaking my skin out at 50 years old or whatnot, because you're pushing too much. So DHA is one of those things where if someone's interested and they're going to do this on their own and they're a woman, I wouldn't start with more than 5 milligrams twice a day. And if you notice anything after a couple of weeks of, I definitely think I feel better, maybe play around and take it up a little bit. But again, I'm not sold on that every woman should take it. That's for sure.
Yeah, I mean, everybody is individual. That's what's important about hormone balancing, is that, you have to know what hormones somebody needs. That's why it's important to test, and that's why it's important to go to a practitioner that knows what labs to order and how to interpret
Yeah,
those labs.
absolutely. For sure.
Laura, do hormones affect insulin? Ever since being on progesterone, testosterone, my insulin has gone way up. Well, of course, hormones affect insulin. What can you say about that, Dr. Wrigley?
Let me read this. Ever since being on progesterone and testosterone, insulin going up. Okay, so I don't think that anybody's going to answer that with just the question, Laura. And I'm sorry because the way my mind works is I'm going, okay, I can think of about 14 different ways that are you taking enough progesterone that's elevating or testosterone that is somehow elevating metabolic rate, therefore your liver's dumping more glycogen, which is leading to an increase in insulin. So I'm not sure I understand how to. I mean, but Shawn, you might have a better.
No, I'm with you. I would answer the question the same way. I think it's just that is too broad of question to really answer without knowing all the
Yeah.
details. Now, I will say this about insulin. And I know some people don't like hearing this answer, but the thing that affects insulin the most, Dr. Wrigley, what is the thing that affects insulin the most? And I'm not making this a difficult question. It's basic. What's the thing that affects insulin the most? It's what we eat, right?
Yeah, it's what you eat and leading
Right.
to the resistance of being able to
Right. So
process.
diet is far and beyond what affects insulin more than anything. Um, so all those details have to be worked out before we can really get to the root of if
Right.
progesterone, testosterone caused a problem. And I think it's true to what Dr. Wrigley was saying. You can go into the pharmacology of it and you can start thinking about how would that affect um, insulin? How would it affect your liver glycogen, things like that? But
Yeah.
ultimately, what we eat is what affects insulin.
No doubt. And if you want to mess up your insulin or reverse the problem with insulin, you need to know the So here's a better way for Laura to understand if she doesn't already get this. If you wanted to go out and create an insulin problem or become diabetic really quick, eat a bunch of refined carbohydrates in the presence of a bunch of hydrogenated seed oil, and you will blow your insulin through the roof, and you will become all kinds of problematic. So there's complication with the two factors of simple carbohydrates raising insulin just because that's what they do to try to drive glucose into the cell. But when you add something like processed seed oil into the mix, then that creates more of the insulin resistance where now the insulin can't get the glucose into the cell, and now you've got a major problem. So if most people could just get this, is that the way out of this mix that's leading people to being obese and diabetic and heart disease and all this kind of stuff is to formulate a diet that, first of all, get rid of processed, refined junk food, get rid of any type of oily fat in your diet that comes from any other source than something like an avocado or true olive oil, which is now almost like we have a hard time even telling people that
Yeah.
now because we don't even know if we get real olive oil anymore.
Right.
But you want to get rid of any type of fat in your diet that's not really primarily a animal fat like butter, lard, ghee, these types of things, with the exception of maybe avocado oil and maybe the exception of something like uh, where was I going with that?
Olive oil. You said olive oil.
Well,
I'm trying to
olive
think
oil,
of.
if you can get really good
Yeah.
olive oil, but no, I was going to coconut oil. If you can get
Oh yeah, yeah, yeah.
really
Yeah.
good pure coconut oil, that's another safe bet too. But the rest of stay away from the sunflower, sesame seed, cottonseed, and number one, stay away from anything that starts off the ingredients with soybean oil, which you're going to find that is the number one ingredient in just about every bottle that you pick up in your grocery store. But those things are so impactful to disturbing your metabolism, basically, really messing up your thyroid function, messing up so many things that are leading to problems with everything from women gaining weight to infertility and all these kinds of problems. So clean up the diet. I think me and Shawn are, kind of circling back around like we always would to look, there are so many things that can be offered every woman to tailor something to her specific goals. This is what I do on a daily basis. But it starts with this. I need you to eat this way, and I need you to time your eating at this way. And I need you to pay attention to things like you need some exercise in your diet, a little combination of, some going for some long walks with hopefully a couple times a week. You focus on some strength training, kind of things like that. I need you to pay attention that you need sunshine and pure water, and you need to stress reduce. Maybe you need to, go to a yoga class or do some meditation or whatever. Then outside of that, if we're dealing with, then we can talk about, well, here's what would be perfect. For you would be, a mixture of, let's say, some USP progesterone with a small amount of bioidentical thyroid replacement therapy to get more T3 into the mitochondria. Or, but I mean, there's all kinds of things that can be placed to make it individual for you, but you can't do, you really are not doing yourself a whole lot of good if you're not willing to do the things that will, make all the difference so that those other things work better, because they won't do them all,
Right.
by themselves. They won't do them all by themselves.
No, that everything's meant to work together. So
Yeah.
it's, hormones is a piece of the puzzle, diet's a piece of the puzzle, and exercise. And I'm glad you mentioned that, because one thing that we forget about insulin, we talk a lot about diet and insulin, and but let's also remember that exercise lowers insulin. And
Absolutely.
I'm a good example. I use this. I'm an endurance mountain bike racer. So
Okay.
I ride my bike anywhere from 10 to 15 hours a week. And I will say, depending on what kind of intensity I'm working out, or I'm riding, or depending on how long the ride is, I'll eat, as you can imagine, Dr. Wrigley, I'll eat quite a bit of carbohydrates, because I'm burning them. But my insulin, I've had my insulin levels checked, and they're super low, because I don't need the insulin to take the glucose out of the cells, because I'm burning the insulin while I'm exercising. So one of the best ways to lower insulin is also exercise.
Absolutely.
Um,
Exercise is so important for everything. So.
Absolutely. Muscle, to maintain lean body mass, to maintain bone health. If you use bone, if you use bone weight bearing exercise.
Yeah.
And Laura's a rock star. She's lost 130 pounds over the last few years.
Great.
Doing a keto diet, and so she's got her diet diet dialed in. Um, and I think she just needs some help with some of the details with the other pieces of the puzzle. Yahada, did we answer all of Laura's questions? Okay. And Dr. Wrigley, we're about out of time here.
Yeah.
So
Yeah.
let's wind this podcast up. As we wind this podcast up, I want you to tell us what you have a passion for.
I have a passion for creating success stories. I mean, that's
Awesome.
really what it's gotten down to now. Is that I'm yeah, after doing this for 30 years, I'm realistic in the fact that I don't know that I want to work forever. Don't know that I, you know, have to do that anymore. But I know what I'm still driven by, and that is I like to be able to go. This can be you too. That especially with something like the internet nowadays, where you're seeing somebody who transformed their life, got their hormones in balance, lost, 100 pounds, or even if it was 30 pounds or whatever, but feels like I sleep better, I have better energy, my skin looks better. People are commenting on that. Wow, what did you do?
Right.
Everybody deserves that. And I love to sit down and build out protocols based on a case that I've taken. And here is the roadmap for you to have that experience of you become your own success story that you can go feel
Yeah.
good about shining all over social media and go look at my before and after or whatnot. But that jazzes me for sure.
So would you call sitting on a beach in the Dominican Republic work?
It's hard. It's hard to
Yeah,
call it work.
I was going to mention something
It's hard to call it
when you
work.
first logged in. I thought, I'm like, you've got to be at a beach
Yeah.
somewhere.
And
And
what's interesting
good for
about
you.
that is that I spend enough time doing, just play. I guess we can call it play, but I'm on my computer so much, either working with clients all over the place or whatnot, or doing research or doing writing or doing whatever, that I often get approached down here in the Caribbean with, man, you just work all the time, and I look at them and I go, I don't really see it that way. I'm
Right.
just I feel like I'm playing.
Yeah.
Like I don't feel like this is really work at all. It's just, hey
My
man,
my
it's been great to
yeah,
get
my
this done. I know we've been waiting on this for a while.
yeah, we have. My wife and I feel the same way. There's an old saying, if you love what you do, you'll never work another day in your life. And I feel that way about what we do. And let's see, did we lose you, Dr. Wrigley? Let's go ahead and stream his website if he's out. So I'm not sure if we lost Dr. Wrigley. Seems like we might have, but here is his website. Dr. Wrigley, tell us a little bit about your website and how to get a hold of you.
Yeah, well, okay. On most of social media, you're going to find me Instagram, Twitter. Twitter's my big because I play with other doctors that are into this space of metabolic health and hormones and stuff like that. But most of social media, you're going to find me at Hormone Diet Doc. That's my tagline on most of it. Facebook's a little bit different. We have a myth busting menopause group where I specifically work with women who are going through that change and how to deal with that. But for the most part, Hormone Diet Doc, you're going to find me around. And then our website is simply DRJAY Wrigley, my last name, which is like the gum. So drjwrigley.com. You'll see all of what me and Heidi do, and which is really work with hormonal and metabolic health. And come visit us, see what we've got going on. Love to hear from you and all that.
Yes, I so appreciate you. We could talk. We're on the same space. That's for sure. We could talk for hours about this. We'll have to have you back on another subject. And I really appreciate it. Our goal is to educate and empower individuals to take charge of their own health. And you've definitely helped us realize that goal. So thank you so much.
Thank you, Shawn. I love it. I hope we do get together again soon. So, all right, take care for now.
All right, thank you. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Wednesday. We have a special episode. It's kind of a makeup episode from last week when Shawn, Casey, and I could not. Our times conflicted. So stay tuned because we're going to have him talk about ADHD, and we're going to have him talk about how you don't need drugs to treat ADHD. You do not want to miss out on that. So Wednesday, Health Solutions with Shawn and Janet Needham. Thank you for tuning in.